Happy Monday, everyone. Todd Houghton here from Houghton Physical Therapy for an episode number 53 of Facebook Live, Todd's top 5 throwing injuries and what are the signs and symptoms of each. In this episode, you will learn the signs and symptoms of the top 5 shoulder injuries in the throwing athlete. Who am I? My name again is Todd Houghton here from Houghton Physical Therapy in Attleboro, Massachusetts. I've been a physical therapist for about 25 years, and I am excited and passionate about helping you add value to your life through the world of physical therapy. What I want to offer is what I've learned through the last approximately 25 years and add value to you by giving you as many different, I don't want to say shortcuts, but as many different ways to make bigger gains without having to learn as much, learn as many different techniques. Again, just to shorten it up for you. So that's what I'm here for. I am passionate about finding the root cause of the symptoms, which is going to relate to a quicker recovery for you and not treating just the results of the symptoms. Please feel free to tag a friend. Please feel free to reach out and ask any questions that you may have, and I always answer the questions later on. So here we go, my favorite part. Well, why did I do the top 5 throwing injuries that I see in athletes? Well, spring is upon us, and I've seen a lot of different athletes out there, whether you're starting baseball, softball, or even spring track, and I see a lot of different injuries that are already kind of rolling through the clinic right now, and I wanted to give you some signs and symptoms so you can kind of diagnose if you need to seek some help at this point. Also, my daughter Livy started throwing the javelin again a few weeks ago, and she developed some shoulder soreness. So overhand throwing injuries place significant stress on the shoulder, neck, and elbow. And this stress is specific to the anatomy that keeps the shoulder stable. These stresses are repeated over and over and over again, and this can lead to a variety of overuse injuries. The most common shoulder injuries that are seen, I'm going to say, in throwing injuries are baseball or softball, but it can also be javelin, volleyball, tennis, and other track and field and throwing events. So here we go. Let's keep this real simple. Anatomy. So the anatomy of the shoulder is, first we need to know that it is a ball and socket joint. So I have a shoulder model right up over here. This is actually a right shoulder. So it's a ball and socket joint, meaning that there's a small socket in here where the ball kind of sits on. The humerus bone is the arm bone over here, and this is the scapula right over here, the spine of the scapula. This is the scapula where the glenoid, which is the rim, which is the socket part. The difference between, as you can see, the difference between the shoulder, and I have also a hip model over here, is that if we look at the hip model, we can see that it's also a ball and socket joint. In the hip joint, the socket is deeper, so you can see approximately half the ball, which means that the hip is more stable and less flexible. Where we have in the shoulder joint, we sacrifice stability for more flexibility because it's a smaller socket. And again, the shoulder joint is made up of the clavicle, collarbone, the humerus, the arm bone, and the scapula. So inside the shoulder socket, it's a round little, it's pretty much round, we'll call it round, is that we have the area called the glenoid, which is the rim around it, and that's where the labrum attaches. The labrum, what that does is it helps to deepen the socket so there's a little bit more stability in the shoulder joint. It also serves as the attachment point for many ligaments as well as the biceps, the long head of the biceps. So strong connective tissue called the shoulder capsule, or where the ligamentous system keeps the shoulder, keeps the ball in the socket when we go to use it and function it. Then we have the rotator cuff muscle, which is made up of 4 muscles that encapsulates the ball part and comes from the shoulder blade. And these actually help to rotate the humerus. The bicep muscle, which we know the bicep muscle on the front of your arm has 2 attachments. One attaches to a bone in the front of the clavicle, as well as one goes deep up and attaches to the top part of that socket. Then what do we also have? We also have the muscles. We have the trapezius muscle, which everybody knows your upper traps. We have the levator scap. We have the rhomboids in between your shoulder blades, some of the serratus muscles, some of the deep muscles, and these are all scap stabilizers, and they help control the scapula, the clavicle bones, and the shoulder girdle, and helps the shoulder joint function just the way that it should. Now I'm going to talk about, there are 5 pitching phases, especially since we're talking more about the throwing athlete. pitching phases, but I'm only going to talk about two. I'm going to talk about the late cocking phase, which when you reach back, and I'm also going to talk about the follow-through phase. In the late cocking phase, to gain maximum speed, what do pitchers do, or anyone, a throwing athlete, we reach as far back as you can when your arm is externally rotated and behind your body as much as you can. But what that does, that puts the ball in the front of the socket on extreme stress. This repetitive stress over time can stretch out the front, can put strain on the rotator cuff, can put strain on the biceps, and also strain on the labrum as well. So, and over time, these ligaments are just going to loosen. Now, the second part is the follow-through phase. During the acceleration phase, when we start back over here for the late cocking phase, through the acceleration phase, the arm internally rotates in a throwing motion. And what happens is, as part of the job, the rotator cuff, especially when the ball is released, when you're following through, the ligaments in the rotator cuff on the back of the shoulder must handle that significant deceleration. And that's when people have, usually it's in the deceleration phase, that they have a lot of symptoms trying to slow down their arm, or they're not following through, they're trying to stop their arm quick. So here we go, favorite part, top 5 common throwing injuries of the shoulder. Number 1 is going to be slap tears, which is a tear in the labrum. Number 2 is going to be biceps tendonitis or a bicep tear. Number 3 is going to be rotator cuff tendonitis. Number 4 is internal impingement, just means there's something inside the shoulder that's getting a little pinch. And the last one is going to be shoulder instability. So here we go. Number 1, slap tears. So we talked on the glenoid fossa, the round rim, which is the socket part. We have the glenoid labrum. A slap tear is a tear of the superior portion of the glenoid, which you can pull down the biceps, and it's usually an anterior to posterior tear. So if I'm looking from the side, there would be anterior tear and a posterior tear. When it's like the biceps tendon gets peeled down. So what are the symptoms of that? Well, the big symptoms is it's going to be a feeling of instability. When we go to reach someone's hand, it might catch a little bit. When you're going to go through any part of the throwing motion, it feels like there's some clicking. You're going to have pain deep inside the shoulder in certain arm positions, and you might notice locking, pain with deceleration, and pain with movements. And you're definitely going to notice a decrease in your power or your speed when you throw. Number 2, biceps tendonitis and tears. So like we said before, the bicep muscle, the long head, attaches at the top piece of the labrum. So repetitive throwing can inflame and put pressure on that biceps, irritate the biceps tendon, which we know the biceps comes down into your upper arm. We can get irritation there, as well as where it attaches on the front part of the shoulder blade. So what are signs and symptoms of biceps tendonitis? Simply pain in the front of the shoulder and weakness or common symptoms. You might have weakness in the bicep, weakness with a shoulder pressing motion, weakness with any of your shoulder motions. And occasionally this repetitive trauma over time can also cause a tear. A tear in the bicep may be when you tear your bicep tendon, you might have a sharp pain in the upper arm, and some people also hear a popping or snapping going on. Number 3 is rotator cuff tendonitis and tears. So we talked about this 4 rotator cuff muscles. The one that is the most common one to tear is the supraspinatus. And when a muscle or tendon is overworked, it becomes inflamed, and then this rotator cuff is frequently irritated through throwers, resulting from a tendonitis, and a lot of times it's from not warming up quick enough, which is a lot of times that we see, or too period of time to ramp up, meaning that they finish their winter sport, but they haven't been working on the baseball related drills, and they jump right into it, and they just jump right into it, and they accelerate too fast with their progression. So what are the signs and symptoms of rotator cuff tendonitis? Pain in the front of the shoulder, pain especially on the side of the shoulder, and pain is present with activity and at rest, which can be a little bit confusing. It's just not with motion. And as this progresses to become something that's a lot worse, they can get pain at night, which can be really uncomfortable, especially when they're sleeping. And a significant loss of strength and motion in the shoulder. And when you have significant tendonitis, it's kind of like tendonitis would be you get some scar tissue built up on the tendon, so it doesn't elongate well enough, and you definitely lose strength and range of motion. Sometimes what can happen too, we also have if we were to look here at the shoulder joint again, we have a thing called a bursa. The bursa is a fluid-filled sac that fits right underneath the scapula, underneath the acromion process, in between the ball. And it's to add a little bit of lubrication in the joint, so there's not so much contact. But when the bursa gets irritated, you can get referred pain down the side of your arm. The fourth one is going to be internal derangement, and that just means during the cocking phase, when you're going to throw, when you're reaching backwards, the rotator cuff muscles in the back, especially if the ball is sitting forward, when you go to cock the arm back, that we get pinching of the rotator cuff in the back, and this pinching over time can get partial tearing of the rotator cuff. Then to go along with, as they're throwing and not having enough, putting so much stress in the deceleration phase, we can get some more tendonitis or some pinching at the tendon, either at the cocking or the follow-through phase. So again, internal impingement just means that we're not really sure, unless we take an MRI or do a scope, what structures are being pinched, but we know that there are some that are being impinged on. What are the signs and symptoms of that? Really just decreased range of motion and significant weakness in your arm. Number 5 is the fifth throwing injury, is instability. Shoulder instability occurs when the head of the humerus, which is the ball part, is not sitting in the socket. This can be during a traumatic dislocation, or it can be if we have a tear in the labrum where there's not enough stability to keep the ball in the socket, that it almost comes out a little bit. It's called a subluxation. It shifts out a little bit, but doesn't go completely out. When the shoulder moves in and out of the socket, whether it's a chronic subluxation or chronic dislocation, this was going to be labeled as chronic shoulder instability, and this is something that really needs to be addressed with surgery. In throwers, this instability takes place over years as those ligaments, remember, when we're reaching back, the ball comes forward, puts a lot of stress on the front of the joint. So there's usually not a specific injury for the instability. It could be a tear in the labrum, and then over time, it happens so much that you can see that it's been a gradual pattern. If the rotator cuff muscles are not able to control the laxity, this shoulder joint can pop in and out of place just like that, and it's very uncomfortable. What are the signs and symptoms? Pain and loss of throwing velocity is a big one, and it just slips out of place as another symptom. Hopefully this was helpful for you. I'm excited about being here again today with the top 5 throwing injuries that we see in athletes. So please feel free to, again, let me know who's there. Please feel free to tag a friend if you think that this was helpful to them. And please feel free to, again, ask any questions or any future topics that you might want to hear me talk about. Thank you very much. Look forward to seeing you next week. Have a good one.